The initial coverage phase is also referred to as the cost after the deductible phase. The standard Part D deductible for 2022 is $480. However, some plans may have a lower deductible or none at all. You will be in this initial coverage phase after you meet any applicable deductible. If your plan has no deductible, your coverage will begin here. While in the initial coverage phase, you will pay a copay or coinsurance for covered medications, which can vary by plan, with lower tier drugs generally having a flat copay and higher tier drugs a coinsurance, which means you pay a percentage of the medication costs. You will stay in the initial coverage level until you and the insurance company combined have spent $4,430 in covered medication costs. Once you and the insurance company have spent $4,430 in covered medication costs, you will be out of the initial coverage phase and in the coverage gap. The coverage gap phase was once referred to as the donut hole because there was no coverage during this time. However, as of 2020, that hole has closed, and now you'll pay a 25% coinsurance for covered medications in this phase. For example, if your medication cost was $100 and you filled that medication in this phase, you would pay 25%, which means you would pay $25. You will be in the coverage gap phase until your total spending reaches $7,050. The difficulty with understanding this phase is determining what counts towards the $7,050 needed to get out of it. There is now a 70% discount that applies towards covered brand medications in this phase. As an example, if your brand medication costs $500, you would pay 25% or $125. However, the 70% discount or $350 also counts as your spending. So, what counts towards the $7,050 needed to get out of the coverage gap is the amount you paid in the initial coverage phase, including any deductible, the 25% coinsurance, and the 70% discount on brand medications while in this phase, and a 25% dispensing fee. Once your spending reaches $7,050, you will be out of the coverage gap and in the catastrophic coverage phase. The catastrophic coverage phase is also referred to as the cost after the coverage gap and is the last phase of coverage. Once you reach this phase, you'll pay no more than a 5% coinsurance for all covered medications until the end of the plan year. If you qualify for a low income subsidy, your prescription costs will not follow the phases as presented because you get extra help paying for your medications from Medicare. To learn more about low income subsidy, also referred to as extra help, or to apply, contact the Social Security Administration at 1 800 772 1213. Another subject that is often confusing for beneficiaries is the difference between a Medicare Advantage plan and a Medicare supplement. So let's compare. Medicare Advantage plans do not supplement Medicare. They provide your Medicare covered services with different coverage rules and costs. In comparison, a Medigap plan does supplement Medicare and covers the 20% coinsurance Medicare leaves behind. Medicare Advantage plans have provider networks. However, Medigap plans do not use provider networks, and you can see any provider that accepts Medicare. Most Medicare Advantage plans offer dental and vision as well as other benefits. However, Medigap plans do not provide these benefits. Medicare Advantage plans generally have lower premiums, with some plans having no premium at all, while Medigap plan premiums tend to be a little higher. When purchasing a Medicare Advantage plan, you can never be denied or charged more for the plan based on your health. However, when purchasing a Medigap policy, you can be denied or charged more if you are not in your Medigap open enrollment or have guaranteed issue rights. Now that you know a little more about the options available during open enrollment, let's talk about some items that may be important when making your coverage decisions. To review, some items you may want to pay attention to include ensuring your providers are in network if reviewing Medicare Advantage plans. For both Part D and Part C plans that include drug coverage, ensuring your medications are on the formulary. And of course, reviewing your costs as they can vary by plan. To review plan options or to enroll, visit Medicare.gov or call 1 800 633 4227. If you are a low income beneficiary, there are programs to help with your Medicare costs. As mentioned, there is extra help paying for your prescription medications. To see if you qualify, contact the Social Security Administration. There is also assistance paying for your Medicare premiums called the Medicare Savings Program. If you meet certain criteria, you may also get help paying for your medical costs. To apply, contact your state Medicaid office. You can also apply for Medicaid there. If eligible, Medicaid will cover your healthcare costs after Medicare. There are other Medicare enrollment periods outside open enrollment. The general enrollment period is for eligible beneficiaries to enroll in Medicare Part B or Premium A if they did not enroll when first eligible. This period is each year from January 1st through March 31st. The Medicare Advantage open enrollment period also occurs at this time and is for those who are enrolled in a Medicare Advantage plan on January 1st of the year and would like to review their options. And special enrollment periods are times throughout the year that allow you to enroll in coverage based on a qualifying situation. Remember, if you do not enroll in your Medicare options when first eligible, you may have to pay a penalty. Also, as mentioned, Medicare open enrollment is not an open enrollment for a Medigap plan. You can attempt to purchase a Medigap plan anytime throughout the year. However, if you are not in your Medigap open enrollment period or have guaranteed issue rights, you can be denied coverage. And finally, if you have Medicare and group coverage, it's important to discuss with your benefits administrator to determine how your Medicare choices will impact your group coverage. For assistance reviewing your Medicare options during open enrollment, you can contact your state health insurance assistance program, also called SHIP. You can locate your local SHIP department by visiting shiphelp.org. Remember, the Medicare open enrollment period will end on December 7th, and any changes will take effect on January 1st.